Hello again. I'm Dr. Johnson, and I'm a doctor who specializes in chronic lymphocytic leukemia, or CLL. And this is Joseph, one of my patients. Welcome back to the CLL Collaborate series. In the first video, Joseph and I talked about the important role patients play in their care and treatment decisions.
That's right. And from the start, patients and their care partners should understand what the diagnosis actually means. Dr. Johnson, can you please explain what CLL is?
I'd be happy to. CLL begins in the cells in the bone marrow, white blood cells called lymphocytes, and then goes into the blood. It's the most common type of adult leukemia. The condition is typically diagnosed through a blood test and confirmed by a bone marrow biopsy. Each patient is different, but some people may have symptoms that lead to testing for CLL.
And when I was diagnosed, I was having frequent colds and sinus infections. Dr. Johnson, what are other symptoms?
Like Joseph mentioned, a high risk of infection is associated with CLL. Other common symptoms may include fatigue, night sweats, enlarged lymph nodes or spleen, fever, and unintentional weight loss.
And it's important to get an accurate diagnosis to understand how an individual patient's CLL may behave. Dr. Johnson, what testing helps you learn more about the specifics of a patient's disease?
This is important as no two CLL patients are the same. So, we should conduct essential testing at diagnosis to get more information about how a patient's CLL may progress, and the results may even help guide treatment options. In addition to a complete blood count, or CBC, tests may include flow cytometry testing, cytogenetic testing, fluorescent in situ hybridization, FISH for short, molecular testing, and imaging tests, such as a CT scan. Your doctor should review the results of these tests with you and make sure you understand how they impact your CLL care and treatment decisions.
Right. It's a good idea to discuss the results with your doctor before you begin conversations about your treatment options. So what other proactive steps can you take to understand your CLL diagnosis? Make sure you understand the specifics of your unique CLL, how it will impact your lifestyle, and if there are symptoms you should be looking out for. Ask whether you have had all key testing and discuss the results with your doctor. Find out if there are any indicators that your CLL is high risk or fast growing. And finally, when it's time to make treatment decisions, ask which tests will need to be repeated.
Great advice. Don't forget to download the resource guide that goes with this video. It provides an overview of the information we covered.
You can also visit powerfulpatients.org/CLL to view more videos with Dr. Johnson and me. Thanks for joining us.